So continuing conversations in studio with us this morning, we have Dr. Nathaniel Duke. He's a medical chief of staff at the Roxborough Hospital, and he's here to talk about his recent award of merit for service in health at the Tobago Day Awards ceremony. Doc, good morning and welcome.
Good morning. Good morning.
All right. So I want to start off by asking you, Doc, how long have you been in this noble profession?
I've been a physician for 21 years. My journey started after I received a scholarship from the Tobago House of Assembly as one of those who were the first recipients under the late Hochoy Charles. And back then, which was about 1998, he sent 10 of us overseas to study medicine. And I think that was a pilot. Mm-hmm. And 21 years after, here I am.
Wow. So the Tobago House of Assembly invested in our people from way back when. What year was that, if you mind me asking?
1998.
I don't want to age you this morning, because, you're looking young and fit. So I don't want to sit here and age you this morning, Doc.
I was very young in those days. I was the youngest specialist medical officer when I returned to Trinidad.
And what did you specialize in, Doc?
Well, fortunately for me, I did my rotations in the United States and Europe, and I was successful in gaining entrance into postgraduate medical training in internal medicine in the US. And then I subspecialized in infectious diseasing at the University of Miami. So I was, at that time when I returned, I was one of 3 infectious disease specialists in the Caribbean, and the only one in Trinidad and Tobago.
Over your years of practice in the Tobago space, because you have practiced internationally as well, but yes, right home here in the Tobago space, what has stood out to you, and what do you think, if we speak toward health, what is needed for us with our citizenry, what is needed for us to pay attention to a little more to make us more healthier individuals here on this island?
We have a eating culture. And a lot of the chronic diseases are stemming from what we are not eating right. So a lot of times when you go to your clinics and you see the chronic diseases, more than 70% of your patients' cholesterol are high. And from that, you know where the problem is. Also, we always hear about chronic diseases, diabetes, hypertension, etc. A lot of those are actually genetic in our population, but it can be controlled. And the lack of control stems from the unregulated diet that we have. Yeah.
What kind of impact has that had on our hospitals, and not only that, just economically, from where you sit?
The expenditure for chronic disease management in this country, just for medications alone, is over $600 million annually. So, and that's just for medications. And if you want to extrapolate that into the actual hospital care, it is projected or estimated that every time you admit someone to hospital who is diabetic with complications of diabetes, it can run you over $1 million a month for one patient. And if we're talking about diabetic foot infections, it's even more than that. So it's a huge economic burden on our healthcare system. The healthcare budget for Tobago is over $500 million annually. And it goes up every year exponentially. So something is not being done right for a small island of Tobago to be incurring such a huge cost for treatment and care.
So is it that you're telling us, plain and straight, Doc, we need to watch what we're eating?
Yes, we need to watch what we're eating, and we need to recognize that we are not a healthy population. But that can change, right? If first you have to admit it, and then you have to work towards it.
Yeah, I think over the years we would have trivialized it. I was having a conversation recently with someone that growing up in Roxborough, I would have heard, villagers and even my mom and my aunt, and they would speak so casually and say, well, this one has sugar or that one has. But only as an adult, I realized how wicked of a disease diabetes is and what it does to the body. But look, I want to ask you, as a profession, in this profession of service, what do you love most about your duties?
Well, you can look at it on multiple levels. So, as a Tobagonian, obviously it's a humane service that you're giving back. It's a service that you will not get any thank you. All right? That's one of the first things that you learn while you are training. Don't look for thanks. But it's a humane service, and many are called, but few are chosen. And as a specialist, you understand that the knowledge that has been imparted onto you, you have been privileged by the institution of medicine to have this knowledge, and you have to use it to serve and be the voice of the voiceless. So overall, beside giving service, you have to be a voice for those who don't have the voice. And you have to also continue the mantra of Hippocrates, where you are a teacher for life. So you must continue to teach and pass on that secret knowledge that has been passed on to you to the younger generation.
For persons who are they're interested in getting into the medical field,
Yep.
You have been there for 21 years. What advice would you give to them?
Well, you have to be persistent. All right. Medicine is not for the brightest, but it's for those who are persistent, those who are disciplined, and those who have a love of people. I have been to university with a lot of brilliant physicians, but they didn't make it. Most of them dropped out because they either lacked the discipline or they were not persistent enough to finish the race. So for the younger ones, you have to have that level of discipline to be able to push through, because it is a lot of material that you have to cover in a short space of time. And, a lot of younger ones, they are into what I call superficial reading. You want to Google the material. It won't work that way anymore. You still have to be able to have the core fundamentals and understand it well if you want to take your knowledge to the next level.
Tell me something, Dr. Duke. There are many areas within the medical field. So everybody won't be a doctor.
Right.
Right? But tell us, because young people, sometime in finding their way, they say, I want to get into medicine, but there are other things that they can do outside of being a medical doctor. Can you share some, and specifically those areas that we're lacking in Tobago, those areas that we need persons to get involved in?
Right. So, beside being a clinician, which is one arm of the medical industry, because it has morphed itself to an industry. So there's the business and economic side of medicine, which is huge. There's the pharmaceutical side, which is even bigger. There's biotechnology. There's research. And of course, there's engineering. Because we have all of these high-tech devices and high-tech instruments that we are using. And one of the biggest issues that we have on this island is, let's say, for instance, the CAT scan or the MRI breaks down. So there's no one on island who can fix it. All right? Or all of our lab equipments. So we must develop that technological engineering, biotechnology base here, where we don't have to rely on flying in people from Costa Rica, Germany, sometimes Trinidad or wherever, when these high-tech instruments goes down.
Right. Okay, I want to go back a bit, as you would have spoken about, as we spoke about getting into the field. With the onset of the blessing and onset of GATE, we now have a flood of young medical professionals. Would you say that the work ethic and compassion and all of that is being passed on, or is it that we are we are focusing more on theory and just getting these young professionals out into the workplace?
So, as a lecturer myself, we teach you the science, but we cannot teach you compassion. All right, and that is one of the biggest problems that institutions are facing. Hopefully, when individuals get out there, they can develop that. But it is something that has to be homegrown within you, innate within you. The science, yes, for those who have the discipline, they will learn the science very well. And for those who are technologically savvy, they will acquire a lot of information within a very short time. But one of the things that we are seeing as senior physicians is, one, sometimes the lack of compassion, or the younger ones just saying, that doesn't bother me, that sort of laissez-faire attitude. And I always tell my juniors, as what was told to me by senior emeritus physicians, you must display obsessive compulsiveness when it comes to your patient. Because what's the difference between a good physician and a great physician, or a good clinician and a great clinician? There's not much difference, The difference lies in a good physician knows when something is wrong and could ask for help. A great physician knows when something is wrong and knows what to do. And that's the major difference. But for a lot of us, sometimes the laissez-faire attitude culturally is not allowing the younger ones to move from one level to the next where we would like to see them, because we will be going out and they have to come in. We will be their patients, but you want to make sure that they do have the clinical acumen to care for you.
Oh my gosh, Doc, you just made such a reality statement there. We will be their patients. And indeed, I mean, one day you will be a patient to possibly one of these very same junior doctors.
Yep.
And it is both inspiring and probably even worrisome. And I mean, of course, it's a mix of emotions, because you want to hope that they are on the right path. But you know what? We are here to talk about your award ceremony, sir. Firstly, tell me, how did you feel when you got the news that you were nominated?
Well, I remember getting this call, and the first thing I said is, me? Because normally when you hear these awards, it's someone who has retired and...
Or posthumously.
Yes, posthumously. So when I heard of it, my first expression was, me, you sure you got the correct phone number? And the lady on the other line said, yes, you have been nominated and selected by the committee. I was like, okay. I was actually driving, I was in the Stanley Park region, and I pulled aside by the Fish Bay because I couldn't continue anymore. I said, let me just pull aside and really understand what this lady is telling me right now. And it was a mix of all sorts of different feelings. One of my colleagues called me and said, I saw you receiving this award. You're on the level of Mandela now.
Listen, once you're talking Pan-Africanism, if we're talking Mandela and Garvey, then you have certainly reached a milestone, sir. You've certainly reached a milestone. And there we have Dr. Duke on stage with the Chief Secretary receiving the Award of Merit for Health for his service and contributions to the people of Tobago and wider Trinidad and Tobago. Of course, congratulations. So, receiving the award in hand, how did you feel?
Excellent. I mean, I was privileged that my mother and father are still alive, so they were there to actually be part of it. I had a lot of thank yous from high school mates, from bishops. They were all calling in and saying, oh, they were so happy, etc. So, it feels good to see that your work is being recognized at the highest level of office. And it only gives you the drive to continue what you are doing, and for 2026, do it even better.
Lovely.
Yes, indeed. All right. Thank you so much, Dr. Duke. Viewers, we were speaking to Dr. Nathaniel Duke, the Medical Chief of Staff at Roxborough Hospital, talking about his lifelong service, 21 years and continuing, and also his Award of Merit for Service in Health, recently received last Thursday, I think that was, at the Tobago Day Award ceremony. Well, that's it for the morning show, viewers. But you know the programming here on Tobago Updates Television is never done. We have a Good Morning Tobago with Chanel Felix up next, here to have interesting conversations with you. Tomorrow morning at 6:15 a.m. be viewing Tobago Updates Television as we pilot premiere Sunrise with yours truly, Lavion, a hard-hitting current affairs morning program where we'll be talking all things Tobago House of Assembly election and anything current affairs that affects you, all the conversations that you need to hear, all the conversations you need to be a part of. So remember, be tuning into Tobago Updates Television tomorrow morning at 6:15 a.m. as we kickstart with a bang. I'm looking forward to seeing you. But Labi and Tinisha will be here on the morning show to take you through as per usual, and then Chanel later on GMT. Remember, Tobago Updates Television is your premier station as we take you through the Tobago House of Assembly election. You don't want to change that dial. And again, thank you if you're viewing us on social media, YouTube, you're watching us on Amplifier Flow or Digicel. Thank you for making us number one. See you tomorrow, guys. Remember, share the live,
Share the live, share the live.